Hey guys, so in this video, I wanted to talk to you about something super important. You do not have bad joints, okay? Now, there are cases where people might have sustained an injury, but you don't just have bad joints, okay? This is something that a lot of people will crutch on, or they'll be like, oh, this runs in my family. I just have bad knees. Oh, I just have a bad back. I'm just getting old. Those kind of things. And I know you're probably already looking at me skeptical, like, well, Taylor, you're not old, you don't know. I understand your perspective. And what I'm saying is that I've worked with plenty of people who are middle-aged to advanced age, and they thought they had bad joints. And when we rehabilitated those joints, 9 times out of 10, maybe even a higher percentage, those people experienced pain relief. They experienced almost, maybe sometimes full pain reduction till it was gone, increased range of motion, increased stability, increased strength, lots of things. So you aren't just a victim of your bad joints, okay? You just don't know what to do necessarily when you have joint pain. So what you have to determine first is following this. Knowing, just accept for a moment, that you don't have bad joints inherently, okay? You may have some genetic predispositions, but that doesn't determine your health or your outcome, okay? What determines your outcome is you. So you have acute injuries and you have chronic pain. Acute injury means something specifically happened at a specific time that caused damage, okay? Chronic pain is a buildup of a sense of pain or discomfort over time as a related to a lot of different factors. So an acute injury, let's specify what that is. It's a strain, it's a sprain, it's a break, it's a tear of a muscle or of a fiber, of a joint tissue, of a tendon, of a ligament. It's surgery. So incisions or cutting of tissues, or specific conditions, which, just so you know, these aren't acute conditions. It's just that we want to put them in this category because even though they're chronic conditions, these things you may want to treat with a little bit more care. And just so you know, a lot of conditions like RA, rheumatoid arthritis, osteoarthritis, OA, and other things, the remedy for those things, if we look at the solution, is actually to do what's prescribed for chronic conditions. So all of these things prior to conditions, the solution is rest and recovery. And once that adequate time frame has passed, then you move on to the following solution for chronic pain. And same thing with these conditions. You're going to move on over to the solution for chronic pain. Chronic pain first is things like that contribute to it are inflammation, swelling, inflammation of the joint, of the tissues around it, the ligaments, the tendons, maybe even muscle, that kind of thing. Diet can increase inflammation. Diet can cause joint pain, actually. Sedentarism, or being sedentary, not using anything, which moves us into the next category, which is disuse. Not using your body will cause it to deteriorate faster. It's a law of nature and it's a law of your body. The use and disuse principle. If you do not use your body, it will erode itself faster than if you actually use it. Or excessive overuse. So with where you're at with your fitness level, you may push it too far to a point where you overuse your body for your fitness level. That's not saying that that level of training is bad. It's just that level of training is something your body isn't ready for yet. You need to gradually increase your use, frequency, volume, or intensity slower until you get to that. You can get to that point. So just don't overuse, but don't let that be your crutch of I'm not going to do anything. I'm going to protect myself. I'm going to sway too hard this direction to the disuse side and just stop doing everything. So disuse and excessive use. You want to be in between those two. And then improper tracking of joints. They're not running in the right direction. Something is going on mechanically in your body where the muscles have pulled your joints out of, or your bones and joints out of alignment to a point where they're not tracking properly, and that's causing friction. It's causing wear and tear. It's causing inflammation, and that's what's causing your joint pain. But if you could just correct the muscle imbalance, the joint would track properly, the pain would go away over time. And so with improper tracking comes range of motion or mobility. Are your joints going through their full range of motion that they're designed to? And if not, we need to work on that. So the solution for chronic pain and the solution for acute injury after rest and recovery and these specific conditions and other conditions is increasing your mobility through mobility-specific drills and exercises. That's establishing range of motion. So for example, because you're like, well, what's mobility? Is that flexibility? Well, it's related, but it's not necessarily the same thing. Mobility is the mobile range of motion your joint is designed to do, okay? Flexibility is more related to your muscles and can those muscles stretch in that range. So, for example, my shoulder, I should be able to have this full range of motion all the way up of my shoulder. I should be able to take it all the way back, without pain or a lot of resistance, ideally, okay? Now, some of you, when you raise your shoulder, it gets stuck here, or you have a shoulder impingement and you experience pain, or when you push, you can't quite get your bicep to your ear, but you can get to about here, but you can't get to here. That would be, okay, I need to work on mobility and essentially range of motion first. The next thing you need to do is once you have full mobility of that joint system, then you want to establish stability. You want it to be stable. So can you just hold your arm in that position without it shaking too much? Or, you probably can't see this on camera, but if I were to squat, right, can I hold myself into a deep squat without my knees quivering and shaking too much? You want to allow for your muscles to adapt to become stable. And then the last thing is, then you want to strengthen, okay? So a lot of people just skip all of this and they just jump to strength training or resistance training too quickly. You need to work on mobility first, get that range of motion fully established in that joint, and then establish a stable base working through that range of motion. And you can work with a professional like us to make sure that your joints are tracking properly. So meaning that they're running the correct direction. You're biomechanically moving in a sound way so you're not doing further damage to your body. And then we can work on strengthening. So if you're experiencing chronic pain, that is, I never had an injury, I never had a surgery, I've just always had a bad back. I don't know why, it always hurts. Or my knee always gives me problems, but I didn't tear my ACL. And sometimes you can have chronic pain as a result of having an acute injury way in the past, but some people just experience chronic pain and they don't even know why. And it's usually related to these or possibly some other factors, but these are the main big hitters, okay? So if you haven't had an acute injury, we're gonna jump you right over to working on mobility drills, and you've seen a lot of the mobility videos that we've done, and if you haven't, you can check them out. If you have sustained an acute injury, let's make sure that we talk with your appropriate medical professional to make sure you're ready to gravitate towards mobility, stability, and strength training. Or if you need to do some rest and recovery first, because then after this period, the issue is that people get surgeries and then they don't do anything after. So they've lost muscle tissue, they've atrophied, they've lost mobility, they've lost stability, they've lost strength, and then they don't do anything about it. And that's how an injury can turn into chronic pain or can turn into a lower quality lifestyle because your joints aren't working as optimally as they could. And so you feel like, oh no, I hurt my back, I had a back surgery, I had a shoulder surgery, I had a knee surgery, and now I can't do as much. You can. We just need to make sure your doctor is approving that your rest and recovery period is over, and we move on to proper mobility, stability, strength training in that order. So if you guys found that video helpful, let us know. Leave your questions in the comments below, because you probably have some questions about, oh, well, what about my neck, or what about my hip? This specific situation, what do I do? Leave those comments leave your comments below, and we'll get to them and help answer your questions. Cool? Okay, I hope that was informative and helpful, you guys. We'll talk to you soon. See ya.